So one of the most important things I've ever learned is how to take a full, deep anatomical breath. So one of the exercises that we have is what's called the Coke bottle exercise. It's a visualization exercise designed to get you to engage more of your respiratory breathing muscles and therefore enabling you to have a much deeper breathing experience, which can really aid in relaxation as well as fitness in general. I'm going to bring you down to the floor and have you lay on your back. The reason we're going to do this laying down is because right now, laying down on the floor, my skeletal structure has permission to be supported by something else other than the muscles. So in other words, we're giving ourselves permission to relax. Now you might still have some residual tension in your body. That's very, very normal. If you have any neck pain, place a small blanket or pillow underneath your head to kind of bring it up off the floor. If you have any low back pain, roll up a blanket or place a pillow under your knees. I'm going to take my right hand and I'm going to place it on my chest. I'm going to take my left hand and place it on my belly. You could switch them up, it really doesn't matter. But this is a feedback mechanism so I can kind of get a sense of what muscles are engaging. I want you to visualize your torso from the bottom of the pelvis to the top of the throat as a Coke bottle. The top of the throat is the opening of the bottle, and the bottom of the pelvis and torso is the bottom. Your breath is going to represent liquid coming into the bottle. And just like if you pour liquid in a bottle, it's going to fill up at the bottom first, and it's going to move its way all the way to the top as it gets more full. This is the visualization that we're going to be using. If you can, I would like it if you inhale through your nose and exhale through your mouth. This is ideal. However, if you find that you're stuffy that day and you need to breathe in through your mouth, that's okay as well. Relax your tongue to just touch the roof of your mouth very gently. We're going to start with the bottom of the bottle and engage this area of the diaphragm. The diaphragm is a muscle that goes all the way down to the pelvic floor and up the back and down into the bottom of the lungs, represented in this area here. I want you to draw your breath very slowly down to the bottom of the bottle and feel your hand lift up as the belly expands, filling up with air. This can be difficult at first. Do not force it. Think more of guiding your breath down there visually instead of shoving it down there with effort. The smoother and more relaxed the breath is, the deeper the breath can be, and the more you will relax as well. Let's try a few more. Just breathe down into the bottom of the torso. Feel the belly rise into the hand, and then let it go. Do that 5 to 10 times just by itself. And then we have to bring the liquid up higher into the torso. So just like pouring liquid into the bottle, once the bottom fills up, the liquid rises to the middle. So in this exercise, once the belly fills up, I want you to maintain the breath in the belly without letting it go, and then try to fill the chest up, feeling your hand expand upward in the chest. Let's practice. Then exhale. So first the belly fills, and when the belly can't fill anymore, then the chest fills. If you start feeling lightheaded, back off or cease the activity and try again later. Chances are your body's not used to it and you're probably trying a little too hard to bring that breath down.
It doesn't have to be big and expansive like you might see my chest and belly doing. I've been practicing it a long time. It takes time. It takes a lot of time. So be patient with yourself. So once the belly is full and then the chest fills up, the air or the liquid comes up to the top of the Coke bottle. And this will be represented by our collarbone feeling as if it's rising into our throat and chin. So first belly, once the belly fills, then I feel the chest. And before I let go of all that breath, I'm going to get this last little bit of inhale by lifting my collarbone up towards my chin. Make sure you let all the air out before you start the next inhale. Once again, try to be slow. Try to create 3 chambers. My chin also stays a little tucked in. I don't want to jump my chin out from the floor. When my neck's in neutral alignment, my chin will have a very, very gentle tuck. Not shoved, just tucked. Finally, once you get acquainted with turning on the 3 chambers and filling them, then the advancement of this exercise is to pay attention to the back of the body as you breathe. So when I do the lower chamber, not only will I feel my belly rise, I'll start to feel my low back gently press into the floor. So it makes the bottom of my torso feel like it's expanding in a spherical shape, both up, down, and on the sides. Let's practice a few of those. Now you're using breathing muscles you didn't even know you had. Next, after the bottom chamber is filled up, we go to the middle chamber, which is obviously represented in the ribs. The hand will lift upward, but I also want to feel my back ribs press down into the floor once the bottom chamber is filled. And then finally, moving to the top half, the collarbone lifts up into the chin, and the tops of the shoulder blades gently pull up towards the ears. First belly, then chest, then the top. When you're all finished, pull your knees up to the ceiling and roll over in a fetal position with your hands underneath your head like a pillow. Slowly press up the floor to come up.
In martial arts, we have a saying, whoever recovers first wins. So one of the strategies from TacFit developed by Scott Sonnen that we try to pass on to our clients here at Siva Fitness is a breath work technique called active recovery. In between our exercises, we don't just take a rest. We actively try to bring our heart rate down so we can be more charged to continue on and have the next exercises become even sharper and better. Remember, as your heart rate climbs, your ability to keep your technique and motor functions tight starts to decline. So we want to get our heart rate as high as possible while keeping technique as high as possible. And this is what we consider to be in shape, is being under high stress, but being able to keep our control of our faculties and all of our motor patterns. So most importantly, step one is to exhale through the mouth. So after you've done your exercises, you're doing your squats or whatever, and then the timer goes off, you want to be taking deliberate exhales through the mouth. Inhale, exhale. I'm dropping my jaw and I'm taking a big winded exhale. Try to avoid the pursing lips of try to open the aperture and the opening of the mouth to get more exhalation. This is phase one. Once you start to bring the heart rate down, the next thing to do would be try to inhale through the nose and exhale through the mouth. Using my belly to breathe into and expand. Inhale through the nose, expand the belly. Now, once you get done with some intense exercise, your body might not be available to do this. You might not be eligible. You'll know this by this intense feeling of your nervous system creating and inducing almost a sense of panic. So if you start to feel panic, just go back to breathing through the mouth. It's all right. But as you want to progress into quick recovery skills, you will then try to go to the next step, which will be inhale through the nose and exhale through the mouth. Once you've achieved inhalation through the nose and exhalation through the mouth after a few seconds, could be 5, could be 30, could be 60, then you might try to inhale both through the nose and exhale through the nose. Still using belly breathing. Once again, if you start to get that sense of panic, you're not quite ready to go there. So go back a level, start breathing through the mouth again, and then when the heart rate drops another beat or two, you might want to try it again, closing the aperture to inhale through the nose and exhale through the nose. Finally, there's a pause that you can incorporate into the breath structure. So for instance, we might inhale through the nose for 3-4 counts, pause for 3 or 4 counts, meaning no breath is coming in or out. I'm not holding my breath, I'm pausing my breath. Then exhale for the 3-4 counts, and then pause again. So it looked like this. Pretty simple. You can make that count structure compact and short or long. It's just a way that's proven to get your heart rate to decrease even more rapidly. We have one more breath pattern that we use a lot in TacFit called survival breath. And this is when you've got like short little compact breaks in between of active recovery and your heart rate might really be high. So what we'll do is 3 sharp belly exhales followed by a long belly inhale and a long belly exhale. Sound like this. You can't really overdose on those things. They're really, really helpful when you're doing some high intensity interval training and you've got just a few seconds to kind of get your wits and your heart rate back down. That's called survival breathing. But don't ever forget, just the day-to-day breath of the cleansing breath is probably one of the best tools you'll ever come across. Just a big inhale through the nose and a big exhale through the mouth. Just let it go. Remember, that inhalation is designed to create even a little bit more stress. So when you let that big exhale out, you actually have gone down in stress level than you were before the inhalation. It's almost like inflating the balloon or eating a big meal and then being able to relieve it. That's where the stress relief comes out. Your exhales are so important, so important. That's how the brain gets oxygen. It's delivered through the blood system. So even though you think you're getting oxygen to the brain when you inhale, it's actually in reverse. You actually could hyperventilate if you try to inhale too much. So try to override the system after you get done working out or with your exercise and you're real huffy and puffy. Your body wants to fight for the inhale. That's not what's going to calm your heart rate down the quickest. Try to really deliberately practice exhaling to get your heart rate back down and to get your focus again.